So today I'm going to do the Man-2 skin test procedure checkoff. So before I go in my patient's room, I'm going to check the physician's orders and just ensure that I am going to perform the right test. And I'm going to make sure that I have a well-lit area to perform the test in. I'm going to gather all of my supplies together. So I'm going to need a 1 cc syringe, a tuberculin purified vial, some gauze, and some alcohol pads. And so I'm going to remove this from the refrigerator and read the label just to ensure that I'm not out of date or anything like that, and everything looks good. And I would make sure to check and see what date that the vial was opened and write my initials on the label. So I'm going to perform hand hygiene and then go into my patient's room.
Come in.
Hi, Miss Kelly. My name is Emily. I'm going to be your nurse for today. I'm going to be in here for about 10 or 15 minutes. I need to give you your TB skin test. Is that okay?
Yes.
Okay, and could you tell me your name and date of birth?
Jalen Kelly, 9/25/96.
Okay, great. And do you have any allergies or anything like that?
No.
Okay, great. Do you have any idea when your last skin test was? And I'm referring to the email that was sent out. So my patient had a BCG vaccine whenever they were a small child. So I'm going to give you a Man-2 skin test, and what this is I'm going to insert this little syringe a little bit up under your arm and push in some solution, and you're going to have just a little wheel on your skin, okay?
Okay.
Okay, so now I'm going to perform hand hygiene, and I'm going to position my patient's arm like this so that when I insert the needle, I can insert it in their forearm. So now I'm going to choose an injection site and put on some gloves, and I'm going to do my wheel on this. So I'm going to get my alcohol pad and clean the injection site. And then I'm going to get another alcohol pad and clean the top of the syringe. The top of the vial. Okay. And then I'm going to take out my 1 milliliter syringe and ensure that the needle is tightly attached to the syringe. Take off my top and inject the air into the vial. And then we're going to turn up the vial and take out the correct amount of fluid for the injection. Okay. And if there were any air bubbles or anything like that, I would just make sure and tap. And I'm going to expel the air. Okay, and we've got a little dot coming out. So now I am going to pull the skin taut and insert the syringe at a 10 to 15 degree angle. And insert my solution, creating the wheel. And then I'm going to dab off the excess with some solution and dispose of my syringe in the sharps container. And I would activate the safety device if it was available on the syringe, but it wasn't available for this one. And I'm going to make sure to not massage the area because you don't want the wheel to go away. You just want it to, stay intact. So now I'm going to perform hand hygiene and make sure that if any bleeding or anything like that occurred on my patient's skin, that I would just dab it gently like I have been with the gauze. So now I'm going to record the date and time and the location of the wheel, and the name of the manufacturer, lot number for the solution, the expiration date, and my name. And then I'm just going to instruct my patient to make sure that you take care of the injection site. You might see some redness. If you see any rapid swelling or redness or anything like that, make sure and contact us. And you need to make sure and come back within 48 to 72 hours of this test so that we can read it and make sure that you don't have a positive reaction. and I'm going to write an appointment card for you and then give it to you, and then we'll come back and read it. Okay, so now I'm going to be reading my patient's skin test and just see if they had a positive reaction or not. So I'm going to gather my supplies necessary. I would need a millimeter ruler, but we weren't provided one in our lab checkoff bag. So I'm just going to pretend like I have one. So now I'm going to go in my patient's room.
Come in.
Hi, Miss Kelly. My name is Emily. I'm going to be your nurse for today. I'm just going to read your skin test and see if you had a positive or negative reaction. Can you tell me your first name and last name and date of birth?
Jalen Kelly, 9/25/96.
Okay, great. And I'm just going to go ahead and look at your arm. I'm going to be touching on your arm a little bit with the pads of my fingertips, swiping around the area where I injected the solution the other day, okay?
Okay.
So now I'm going to perform hand hygiene. And I'm going to inspect my patient's arm. I'm going to make sure that her arm is in a well-lit area and make sure that she has her elbow flexed just a little bit so that I can correctly identify the injection site. So now I've identified the injection site, and I'm just going to take 2 fingers. So I'm just going to inspect the patient's arm, and I'm going to take 2 fingers and touch lightly with the pads of my fingertips around the area. And then I'm going to sweep my fingertips 2 inches in diameter from the injection site in all 4 directions. And then I'm going to use a zigzag feather-like touch to palpate for the induration margins. And I would repeat the palpation process again with the patient's arm raised at a 45-degree angle. So now I'm going to move my fingertips toward the injection site without lifting them. So now I have located the induration with my fingertips, and I have them resting firmly against the side of the induration margins. So now I would use a ballpoint pen to mark the widest edge of the induration from thumb to pinky finger with a fine dot. And now that I have located the induration margin on the other side of the patient's forearm, I have placed a second mark of the induration on the right side. So I'm just going to palpate one more time with my fingers and in movement towards the injection site just to make sure that my dots are right. And then I'm going to use the millimeter ruler and put the 0 ruler line on the inside of the left dot and measure to the outside of the right dot. And I'm going to make sure not to measure any erythema or swelling, because that's not the induration. We want to make sure that we're only measuring the induration. So the measurement is 10 millimeters, which is a positive reaction. So I'm going to record the millimeters on the Mantoux skin test record form, and then I'm going to record the date and time that the test was read, and my name and signature, and then the presence or absence of adverse reactions with the patient. The patient didn't have any physical adverse reactions, but they did have a positive skin test. There was no blistering or redness or swelling. And then I'm going to make sure that my patient knows the significance of a positive reaction or a negative reaction if she would have had one. And then make sure that my patient knows that she's going to need to follow up with her provider and schedule an appointment with them since she did have a positive reaction, and provide documentation and a copy of the Mantoux skin test record form for her to take to her provider. And then make sure that she understands the importance of retaining this information. And then I'm going to provide any cultural or linguistic educational material that I would need to for the patient.